and then I'll start.
Okay.
Welcome everybody. This is the annual general meeting of IOW NHS Trust. Thank you for dialing in to this Microsoft Teams live event. My name's Kirk. I'm the Director of Communications and Engagement at the Trust, and I just want to run through a couple of bits of housekeeping before we start. You will be able to ask questions and interact throughout the presentations today using the Q&A function. Please feel free to post in there using your name, or you can post anonymously. I will help us move through the agenda today, and I will do my best to bring your questions into the speakers, and our moderators will also reply directly if we're able to. So without any further ado, because we've got a pretty packed agenda, I'm going to start the event.
Great, thank you, Kirk. Hi, I'm Vaughan Thomas, for those who don't know me and haven't seen me before, Chairman of the Trust. This is the third event like this that Maggie and I have hosted, and today I'm your host for what is billed as a year of improvement. What we're going to try and do today is, rather than have someone like me talk to you, I want to make sure that you're getting access to key executives who run the frontline services and actually have their view of what's going on with clear evidence. And of course, you'll have the opportunity at the end to ask any questions you might have. So without further ado, I'm going to hand on to Maggie Oldham. There is an agenda slide which should come up. There it is. And you'll see that it runs from Maggie through to Joe Smythe, our Chief Operating Officer, Leslie Stevens, who is our Director of Mental Health, Joe Smythe with Leslie, Dr. Nikki Turner, who's been doing a lot of our strategic work for us, and then Darren on finances. And although you see my name there, my role is a bit part there to do with approval of the accounts. And then Kirk will take questions from you. We'll deal with as many as we possibly can in the time. And after that, Maggie and I will close the meeting. And during that session, I'll also reflect on the last 3 years, not just the current year. So without further ado, Maggie, if I hand over to you.
Thanks, Vaughan, and good afternoon to everybody that's been able to join us today. It does feel somewhat strange undertaking this annual general meeting in this virtual way. And for those of you who have been able to join us this afternoon, you'll know, if you've joined us before, that I don't ever claim to be a great public speaker, and I would much rather be in the same room with you to be able to see your faces and engage with you in a much more personal way than this. So, like many of you, we are all having to get used to doing things in a more virtual way. And as the announcement from our Prime Minister earlier this week has indicated, sadly, I think we'll have many more months where we're having to work in this way. So I'm sorry we're not all together in person, but I am glad to those of you who've been able to join us this afternoon. So I want to start my short presentation by talking to you about our Getting to Good journey. And I want to remind us all of the real improvements that we have been able to see over the last 12 months. So when the CQC, our regulator for quality, visited us last year, we were really pleased that they fed back to us, both in verbally but also in their reports, that they found real improvements. And we were really pleased to hit a very important milestone and see our rating with the CQC go from inadequate to requires improvement. We do feel we've got a great deal to be proud of, but we do acknowledge we've still got a lot of work to do. I have to give particular mention to patient transport services. As you know, they were rated outstanding for caring, and there were some tremendous examples that they were able to demonstrate to our regulator around how our staff go above and beyond to provide a really superb experience for our patients, and how well they work within our organisation. We saw examples of outstanding practice in the end of life services, and we have, through the course of the year, continued to work to improve those end of life care services that we provide. More recently, with the opening of a pilot scheme of our Wellow ward. Our community services were rated good, and that was a real good testament to all the work that our community staff have done, along with our NHS 111 that was rated good, as well as urgent care services, which again across all of its domains, not on an aggregate position, were rated as good. In January 2020, the CQC reported further improvements in our community-based mental health services, and they gave us feedback that they could see that we were demonstrating that our community mental health services were moving forward in a very positive way. We have now met all of the terms of the warning notices, and for those of you who have been following our journey, you'll have heard me say before, you get issued with a warning notice, and it's not as simple as the CQC lifting those warning notices. What we have to do is comply with all of the elements of the warning notices, which we have now done. And as you can see on screen, the full report, the 2019 report, along with the 2020 updates, are available on our website should anybody wish to have a look at them. I'm also really proud over the course of the last 12 months that we published in September 2019, along with our partners in the Isle of Wight Council and our clinical commissioning group, our joint 3-year plan to support people live healthy and independent lives. And that health and care plan talks about three pillars, and we talk about these pillars frequently at our board meetings. So new models of care, particularly focused on our community services, partnerships with other NHS organisations across the Solent that will help us have stronger critical mass and enable us to work towards a more sustainable, both clinically and financial model going forward. And the third pillar, really important pillar for all of us, all of the organisations, is productivity. How do we demonstrate that we are as efficient and effective as we possibly can be? We all pay tax, and it's really important that we use those taxpayers' good contributions as efficiently as we possibly can. We do monitor the delivery of that plan very frequently and robustly, and I am pleased to be able to say that despite the impact of COVID during the early part of this year, we are still able to demonstrate that we're making good progress. And I think in certain areas, working within the confines of COVID has absolutely sharpened our focus, particularly with the work that we've been doing in the community and with the partnerships, and we've been able to fast track some of our aspirations from our health and care plan. I've entitled this next slide A Bright Future, because I genuinely believe that's where we are at now in our organisation. We are obviously very concerned about what challenges of COVID are going to send our way during wave 2. But I think if I talk for a moment of where I feel we're at, if we take away COVID for the moment, then I'm really very clear that we are very able to demonstrate that we will continue with our focus on continuous improvement. We've really been able to embed over the last period a framework for continuous improvement, and we continue to see great results as a result of that. We have a continued commitment across the 3 organisations on Ireland that provide health and social care to work towards the delivery of that health and care plan, and we also are working towards the delivery of our trust strategy as well. I've been delighted to be able to work in partnership with Solent, SCAS and Portsmouth University Hospitals with our partnerships. And I do genuinely look forward to our next CQC inspection, where I personally believe they will be able to see evidence of how we've moved from requires improvement into the good zone. And it will be at the next AGM when we're able to update you on the progress in this formal way. But obviously, as soon as we're able, we will be putting out local information. We do expect to see the CQC COVID permitting in the next few months. And again, we're going to say more about investing in our future later. And some of you will remember that we had the announcement way back now last year from the government that they were investing 48 million in our organisation to help secure its future. And Darren will talk to you a little bit more about that in a little while. So in general, our response to COVID has been really tremendous, and I will always be indebted to our staff and thank them at every opportunity I get. The way we stood up and prepared for wave 1 of coronavirus has been really tremendous. We were able within weeks to be able to prepare 200 additional beds and 3 field hospitals. Sadly, we've not been able to invite our local community in to see those those facilities because we have to be so very careful around the transmission of COVID. But I know some of you will have seen the pictures that we were able to put into the newspaper, and we were really very proud of the way we were able to respond. And of course, being an island and having all the constraints of size and scale, we recognised very early on in the planning that we would need to work with our partners across the Solent if we were to see very large numbers of patients who were affected and needing hospital treatments. So we worked, as you will, many residents of the island will have heard the Chinook helicopters when they did their training runs with us. And we've also, as many of you are aware from local media releases, we've been really pleased to work with Hovercraft as well as a partner to be able to ensure we could expedite transfers should we have needed to. And again, both those field hospitals and those improved transport arrangements we will continue to use if we get adversely affected with the next wave of COVID. We have had hundreds of our staff who've had to shield, work from home or be redeployed. And again, everybody has worked together to make sure that we're still able to function as a health provider with all of those constraints. We've had a major focus on staff health and well-being, as you would expect. You've heard me say before, I genuinely believe that if we can get things right for our staff, then we will see great outcomes for our patients. And we've intensified that work during the COVID period because it's been so vital to ensure that our staff are kept well so that they can care for us. Sadly, we had to pause our outpatients and surgery. It wasn't a decision that we made in isolation. That was a national mandate that was passed down to all NHS organisations. And as you also know, we're working hard now with the recovery to try and bring back as much of our activity as we're able to. Currently, we are upping the amount of patients who we are treating from an elective perspective, but we've constantly got our eye on what the winter and what a COVID wave 2 will bring to us. We've worked extremely hard to keep our emergency and cancer services going. You'll hear a little bit more about that later on. We've also had additional investment to keep more ambulance crews on the road, and I'm really pleased that that's had an impact on our performance from an ambulance perspective. It's been very challenging for all colleagues in health and social care, but I am able to confidently say that our staff kept our patients at the centre of what they do, and we have continued to strive to keep our community safe. So we've also had to have a major reconfiguration of the hospital, and this is an issue for us that will continue for many, many months. We have got to have bigger waiting areas, and we've got to have one-way systems. We've got to have drop-off only points. We've had to restrict the numbers of visitors, and we've had to keep a real keen eye on social distancing. I am really pleased to be able to say that our cross contamination and infection rates have been extremely low here in the Trust. And again, I am really pleased that we've been led as well as we have by our Director for Infection Prevention Control, Alice Webster. And I'm really pleased with the absolute strict adherence to those policies that our staff have shown. Sadly, in other organisations, some other NHS organisations, cross-contamination has been a real problem. But again, I think the fact that we've been able to manage as well as we have demonstrates that we are no longer an inadequate stroke rise. It requires improvement. I'm pleased to say that our outpatients department now is operating at 90% of its pre-COVID numbers, and we are looking to improve those figures before the end of the year. We've got more surgery happening, and whilst we've got an increase in our waiting list, which is a real challenge, we are working not only here on the island but as a system to look at how we can work together as an NHS family to be able to reduce those lists as quickly as we're able to. We will continue to prioritise patient by clinical need, and we are working as fast as we can in order to do that. We've got our third CT and MR scanners, which are really going to help us improve the experience for people from a diagnostics perspective. And Kirk, that was the end of my short opening introductory slides.
Thank you very much, Maggie. Matt is covered there already. I'm spending a bit of time while people are talking in the Q&A. We haven't had any questions to pick up just yet, but hopefully people will start to send them in. What I'm going to do now is I'm going to bring in Joe Smith, our Chief Operating Officer, and he's going to talk a little bit to you about some stuff we've already heard about our COVID-19 response and recovery, but Joe's been right in the thick of it from the very start of the pandemic, and will give you a really interesting perspective on what's been going on at the Trust. So I'm just going to hand over now to Joe. You're on mute, Joe.
Sorry, typical schoolboy error there, on mute. Hi, as Kirk said, my name is Joe Smith, and I am the Chief Operating Officer here at the hospital and for the ambulance service. And I have been asked to talk to you this evening about our COVID response. And I think more importantly for you, the things that you want to hear about is our COVID recovery. And I will come on to all of that in a moment. Today is an important day for me, actually, because it's my 1-year anniversary here at the Trust. And if I look back at the beginning of this year, I don't think any of us could have imagined the year that was in store for us. I have to say I've been immensely proud to be on this island for the year, not only the way our staff have responded, but the way the whole community have gathered round and supported the Trust and the hospital, and how people have been so respectful of the rules and regulations that we've unfortunately needed to put in place. I just want to thank everybody for their ongoing support. Maggie has covered off some of the points that I will make this evening. But I think it's worth actually just spending a little time and reflecting about the response COVID outbreak. If you remember back in March when we faced that down, we were not clear about what the impact would be, and we needed very quickly to turn the hospital around and to change things. And I think we did that amazingly. Maggie mentioned about the 200 field hospital beds, but we also managed to completely change the way the hospital operated. We had to stand down outpatients, we had to stand down surgery, and that's not just a simple case of unplugging services. You have to do that in a very planned way so that we can make sure that when we're restoring those services, we know how to restore them by making sure that people with the most clinical need are brought back first. So that was all done really very safely. We put additional ambulances on the road, as Maggie has alluded to. That has actually significantly improved response times, and I think lots of people will have felt the benefit of many of the changes that we put in during COVID. While we suspended outpatients, surgery and diagnostics, we changed the way we were working as well. So many of our outpatient services are now, and thanks to COVID, being delivered virtually, and I'll talk a little bit more about that later. But the main point of my presentation this evening is about our recovery. So while we shut down a number of services during recovery, one of the services that we wanted to make sure that we kept going were our cancer services. And I'm pleased to say that we kept cancer services running throughout the period, and actually cancer services now in the recovery phase have actually turned in better performance last month than they have pre-COVID. And we plan to maintain that and to improve services. So the cancer services are now back to better than pre-COVID levels. We have undertaken a major reconfiguration of the hospital. What that's meant in practice is we've had to relocate services around the place. There has been some disruption to those services, but that allowed us to create larger waiting rooms so that we're able to keep the social distancing required in those waiting rooms. We're continuing to ask people to turn up just a few minutes before their appointment because that saves congestion in the waiting rooms. We're also asking people if they can come on their own where possible. That isn't always possible when people have carers, but again, this is just in terms of trying to reduce the congestion in the hospital and therefore reduce the viral load. The outpatient activity is back to 90% of pre-COVID levels, and we have a target of making sure that that's back to 100% by October, and we're working hard to do that. Endoscopy services are also on track, and we're making very good progress there. And I'm pleased to say that just last Saturday, we started our first weekend list in endoscopy, and we'll be running them throughout the winter, and that will bring us back on track. And again, the aim is that endoscopy waiting times will be better than pre-COVID levels by March next year. You can see on the slide that we're also planning on expanding our MR and CT scanners. I can tell you that the CT scanner, the third CT scanner, will actually be arriving on site this Saturday. So that will provide additional capacity for us once we're able to commission that and get that up and running. The plan for CT and MR is that they will be at 100% of capacity also in October. So that means that we are back in a number of services to where we were pre-COVID. It doesn't unfortunately mean that we're at the same place with waiting times, because obviously if you suspend a service, then you are going to build up additional waiting times into the system. So that's why we need additional CT and additional MR to clear that backlog. So while we're at 100%, we have a way to go in terms of managing the backlog. Of course, the major challenge for us is in restoring elective inpatient activity. So that's people coming in for their operations either as a day case or as overnight. This is incredibly challenging for us, and the reason it's so challenging is because we have to implement stricter infection control measures. That means that previously, where we might be able to get 5 or 6 operations done on an all-day list, we're now down to 2 or 3. We have to leave greater time between procedures, enhanced cleaning measures, completely separating elective flows from unelective. So that means people coming in as an emergency into theatre. They all have to be separated out, which ultimately means we have less capacity in theatre and we have more people waiting for operations. So you can see why this is now challenging. We're exploring multiple ways of bringing that waiting time down. A key strand for that for us is the use of the independent sector on the mainland. And we're really encouraging people to take up this offer of procedures that would be undertaken in the private sector or in the independent sector on the mainland. They're CQC approved environments, and the operations are undertaken by NHS consultants. And we are going to continue to ask our residents and our patients if they would transfer care over there, which would be continued to be provided by an NHS consultant. This will help us start to get the waiting times down. Of course, we're going to be doing more activity at the weekend and evenings, all of which will help to bring our waiting times down. So the story really for us is outpatients, diagnostics and endoscopy back to normal, clearing waiting lists better than before by March next year. And we will continue to be challenged by the elective inpatient and day case activity. Thank you, Kirk. Kirk, I think you're still on mute.
How embarrassing. Thank you very much, Joe. Lots and lots of information there, and it's obviously really of interest to the people on the call, because we've had a flurry of questions. Some of those are going to be addressed later on in the AGM, but if you don't mind, Joe, there's a couple that I'd quite like to deal with now. One is about learnings from COVID and what that might mean for winter and our preparedness there. And then a second question is about whether we expect the second wave of COVID to have an impact on the services that we've recovered so far. Two very good questions, and I'm just going to bring you back now, Joe, to pick those up.
Thank you, Kirk. There's been huge amounts of learning from the COVID response and the way that we've had to react and the way we've had to continue with services. The thing that I think people will notice most in terms of the learning is the adoption of the virtual world. The number of appointments that we now do either via telephone or by a video link like this. About 30 to 40% of our follow-up appointments can now be provided virtually. We have also learned that we are able to rely on services outside the hospital to provide more of those services, so we don't need to bring people on site. So another big part of that learning, and a significant change that I hope people will see soon, is the transfer of phlebotomy services. That means where you come and have your blood taken out of the hospital into GP practices. I've already had several patients say to me how much better they felt about being able to go along to their GP practice and have their bloods taken rather than have to come the whole ways into Newport, into a busy hospital, and find their way home again. So that's just two examples of the learning. Of course, we're planning for a second wave as well. And those additional beds that we spoke about earlier on, those 200 beds, we haven't taken those down. We haven't taken away the additional ED, accident and emergency capacity that we have out of the back of the hospital. We haven't stood down any of that. All our command and control mechanisms are still in place to allow us to respond. So while there's always a risk that we may be overwhelmed going forward, which is why it's really important that people continue to adhere to the guidelines, there's always that risk. We have put in as many measures as we can to ensure that we do not have to stand down our elective programme again.
Thank you very much, Joe. we're going to move on to the next section in the agenda, which is our partnerships. And I'm going to hand over to first my colleague, Dr. Leslie Stevens, Director of Mental Health and Learning Disabilities, to talk about the Trust's partnership with Solent NHS Trust. And then we'll hear from Joe Smith again, who's going to talk about our partnership with Portsmouth for hospital-based services and our ambulance service partnership with SCAS. So without further ado, I will bring in Dr. Leslie Stevens.
Okay, thank you, Kirk. So I want to talk about the Mental Health and Learning Disabilities partnership with Solent Trust. We're almost a year into that partnership now. It began in order to help us improve the resilience and sustainability of our mental health services. But I think one of my reflections on it is that we're the smallest NHS secondary care mental health service in the country, and we're on an island. And one of the real issues for us was around professional isolation. And it's been such a positive experience, I think, for me, for my team, for the wider service, to be able to build those relationships across the boundaries of our organisation, to share learning and share experience. I think it's been great, and it's been particularly positive through this COVID period. And we were able to work very closely together. I think we had some positive things to support Solent with, and vice versa, in creating a plan around the mental health response to COVID, which clearly was challenging and was different from the acute hospital response. So I think real intangible benefits, but also some real tangible things too. The main focus of the work through the partnership has been a transformation programme in which we are redesigning our services in order to ensure that we deliver better outcomes for people, and that we improve the experience both for people who are using the service but also for staff who are working in the service. And we kicked off that programme with Solent support in January and had a whole series of workshops. Our intention all the way through this work has been to do it in partnership with as many people who are involved in the mental health and learning disability system as possible. And so we had a series of workshops in which we had staff, people who use services, family, carers, other stakeholders coming together to do some really creative work around redesigning our services. And then COVID hit and kind of stopped us in our tracks. And we paused the programme for a little while, but then decided actually it was too important to just put to one side for any length of time. And so continued the engagement for the design part of the transformation programme online. And it was quite a revelation in some ways, particularly when we're thinking about engaging with people who use mental health services. Some of the feedback we had around the remote, the kind of video conferencing sessions were more positive than those in the face-to-face room. People find, some people clearly find face-to-face more easy to engage with, but others found the video and the chat functions and so on actually a really positive experience. We're now right in the thick of writing up the outcome of all of that engagement work, and that will form the content of a mental health strategy document that we're going to take to our trust board in public in October, and then it will be published soon after. We were wanting to go out and have conversations with as many people as possible about the content of that strategy and what we need to do to implement it over the next 1 to 2 years with support of the partnership. So I think that's all I wanted to say. Coates, do you want me to hand over to Joe now, or any questions to pick up? You're mute, Kirk.
Thanks, Leslie. Just one question pops up in the Q&A while you were talking, and I think it's relevant to the transformation programme that you described. An attendee has asked whether there are specific lessons from COVID that we've identified through that work and what that would mean for mental health
I think there are many lessons. I think one of the things from a mental health perspective that's been really striking is that we've been able to move very quickly to change services and to work across boundaries of services. I think the key change, as an example, that we put in place was the creation of an integrated mental health hub, and we were able to put that in place very quickly, and we were able to bring in third sector organisations, the local authority, support from the substance misuse service, which is delivered by another trust, and kind of a whole range of services coming together to respond to people in mental health crisis. So I think that the speed with which we were able to act, the flexibility that we were able to achieve across traditional boundaries was really impressive, and I think they're the things we need to carry forward into the future.
Thank you very much, Leslie. There are a few other questions popping up in the Q&A bar, but we're going to proceed with the rest of the agenda, and we'll pick those up as we go along. So next of all, I'm going to bring in my colleague Jo Smith, who's going to talk about some more of our partnerships.
Thank you. You're probably going to be sick of the sound of my voice by the end of this. But I just want to talk to you briefly about the partnership arrangements that we are developing for the acute hospital with Portsmouth, and also with our ambulance service and the ambulance service on the mainland, which I'll come on to in a moment. So we've been working in partnership with Portsmouth for some time now, and in February we announced the formal partnership, but we've been working with them for some considerable time to get to that point, and working with them in many ways on a practical level long before then. The real focus of these partnerships are about making our services more clinically stable. When you work in a small hospital, small environment like this, it's much more difficult to make sure that the services continue to be stable. So that's the whole purpose of these partnerships. It's about strengthening our ability to provide excellent clinical care for our island community. So, as I said, our clinical teams have been working very closely together for some time, and we're just formalising that a bit more now, making that work better and driving the changes forward that we need. Those partnerships allow us to tackle some of the big issues facing us. So one of our big issues here is recruitment and retention. And the reason for that is because if you go and you work in a big hospital, there's lots of opportunity to do various different things. There's opportunity to work with many, many different colleagues, many, many different consultants, which is not always true when you're in a small hospital. So by us linking with Portsmouth, we're able to offer job opportunities to people where you can have the work-life balance, live on our lovely island, but also have career development by, nipping across the Solent to work in a much larger environment and to work as part of a multidisciplinary team in a virtual environment as well. So you get the best of both worlds, and we get the best of both worlds here on the island by being able to do that. We want to work as well with them because we want more resilient services, and as I said before, small isn't always necessarily beautiful, and small is certainly not always resilient. So we have issues here where we have small teams. If one person goes off ill, there's a massive impact. By being part of a bigger partnership, it means we can call on colleagues, we can make sure that services continue to work. And we are going to continue that and explore how our teams can work together. So that all sounds very, very dry, and really what does it mean in practice? So an example of that is our cardiology teams have been working very closely together recently. So benefits that have come out of that almost immediately is, why don't we buy the same equipment as Portsmouth? That means we tag into a much bigger contract. That means we pay less like anybody else. So that comes out immediately. we're able to develop single pathways so that if patients have to transfer from the island to Portsmouth, the pathways are seamless. We get access to larger clinical dialogue, more research, all of that by working closer together. There's enhanced career developments for our cardiologists there, and of course that then leads to expanded recruitment. So there are numerous examples of that we're working in the sector. In the ambulance division, that has been an established and a strong partnership, been running for a considerable period, over 18 months now. That partnership was strengthened significantly during the COVID response. Interestingly, actually, we probably provided more support to South Central Ambulance Service during that period than the other way around. And we did that by recruiting a large number of call handlers to work in the 111 service. And as you know, the 111 service was a critical and vital part of our COVID response. And our service here on the island was actually taking calls from many people on the mainland and directing people on the mainland to services over there. So we were a big support to the mainland in terms of the 111 response. Of course, more generally, working with SCAS has the same benefits to us as it has in the acute, in terms of working with a bigger provider and providing more stability. A big component that's come out of that is the computer-aided dispatch system. It's basically the system that when people dial 999, it tracks where the caller is versus where the ambulances are and how to get a response as quickly as possible to the patient and to the person in need. So by being able to tap into the SCAS CAD system, that's had a big benefit for the island. So it works both ways. So we are supporting each other, and we're looking forward to a much closer integration, share technology and improve services for all of our patients and our staff as we go forward. I will leave it there, Kirk, and leave time for questions unless there's anything else that people want me to expand on now.
Thank you very much, Joe. There are a couple of questions that I think we better pick up now rather than leaving them to the end. One is about the acute partnership with Portsmouth and whether we think that that will lead to more services being provided off the island on the mainland. And the second question, there's a couple of questions about the potential impact on staff and how the two organisations will work together. I hope I've summarised those questions okay. I'm going to bring Joe back in now, if that's all right.
On mute. Sorry, realised I was on mute. So easily done. Generally, there isn't a plan, well, there isn't a plan full stop to move services off island. Services are provided by Portsmouth and Southampton on island, so there's an in-reach service where they come and provide services here. With the advent of virtual technology, there'll be more services, I think, provided by Portsmouth from Portsmouth, but into the island virtually. And I'm, confident that we can provide enhanced services here for people on the island in a much better way by that partnership. There may be some services that will eventually need to move across some very specialist services, but that's true now because some of our cancer patients go across now. So that really isn't any change to the way we've been working up to now. I'm not quite sure, Kirk, what the question was in terms of staff. You're on mute, Kirk.
That's fine, Joe. We can pick up the question about the impact on staff in the Q&A. I'll have a look at the question and the other panelists will be able to reply in the chat bar. The next section on the agenda is about the Trust's new strategy, and I would like to introduce my colleague Dr. Nikki Turner, Director of Transformation, who's going to talk to you all a bit about the new strategy and what that means.
Thank you, Kirk. As Kirk said, I'm the Director of Strategy. I've been on the island for many years, and it's just great to talk to you about what we've been doing over the last year. We have produced a trust strategy, and we did that earlier in the year. We did actually delay the launch of that due to COVID, but during the time our staff have worked very hard on actually how we're going to deliver that strategy. I must say it's a really fantastic document. I'm really privileged to have been involved in that, and we had many of our staff members also involved in putting that together. For our organisation, a strategy is really important. It sets out our direction of travel, what we want to achieve, why we want to achieve it, and how. And it gives our teams as well the ability to plan and make decisions about the services we're going to deliver as we move forward in this year and many years to come. The strategy also considers the long-term plan. It also considers the island's health and care strategy, health and care plan, which Maggie mentioned earlier. For us, it gives us a roadmap. It tells us how do we get from here to actually deliver our vision, and that's on the next slide, Kirk, if we could have it. So our vision and our mission actually describe what we want to achieve and why. As it says on the slide, our vision is high quality, compassionate care that makes a positive difference to our island community. And what's really important to us is in particular our values. We had a lot of engagement with our staff to actually come up with those, and I'd like to give you just a few examples of actually what they mean. For compassion, it's really important we help others in need whenever and wherever they require it, and we show empathy and we show support. Again, from an accountability point of view, we really have to evidence that we provide safe care. So important. And respecting each other, whether it's staff members, it's members of the public, it's our patients. We really have to be open and honest. We have to ensure that we take up people every step of the way. They understand what we're doing and why. And also what's really important is we celebrate success. It's not something that we've been good at doing in the future, in the past, but certainly Maggie gave some examples of some of the successes of this year. And finally, everyone counts, putting people first, valuing the differences and promoting inclusion. You will hear a lot of that going forward in the future years as well. Some fantastic examples that in particular Leslie alluded to around mental health as well. So just going on to look at our objectives, it's really important we set clear objectives. We look at how that supports us in delivering our strategy and improving our services. What we've done is we've created the 4 Ps, and I'm just going to give you a few examples of what that means. And you will see we've got a strapline there, great people, great place. So you will start to see this across a lot of our trust board presentations, our reports, and other things that we do. So thinking about the strategic objective of people, there's a couple of things I wanted to sort of tease out. You know, it's really important for us that the people that work in our teams make a positive difference every day, and it's so important we feed back to our staff, but we feed back to patients the impact that's had. You heard earlier around the impact of COVID, but also some of the learning that we've taken and what we're going to do in the future. You will hear a bit later, in particular around place. You know, we want to invest to improve our patients' experience in sort of health and care. We will, and again, Darren will talk about this later, be investing in our buildings and IT. But you've also heard earlier from Joe as well that the positive impact of sort of entering the virtual world, making it easier for people to have appointments with minimising the amount of travel that they have to do. Around performance, you know, we're absolutely committed to actually improving every service that we deliver, whether we do that in partnership or whether we do that with partners locally on the island, or as mentioned before by Joe, our NHS partners that we are already engaged with. We very much understand that we need our partners, whether local or on the mainland, because we can't face these challenges alone. Maggie clearly expressed the need for clinical and financial sustainability for our services, but it's for all the services on the island and for the public that we serve. So finally, I'm just going to quickly talk a little bit about what you can see over the next 5 years. And I think the next 5 years are going to be exceptionally exciting. I'm really in a wonderful place of being the Director of Transformation and actually seeing us on this journey. Now, clearly, we have to focus on delivering high quality services. We have to get absolute value for money. And again, Joe gave a really lovely example earlier about collaborating with mainland partners and actually reducing the overall cost of whether it's IT solutions or others. And we have been on this journey and are on this journey to getting to good. And as Maggie described earlier, we will have our CQC come and visit us in the very near future. And it's important that you get to hear the improvements we have made and you see it through their eyes as well. I mentioned about the major investment improving and buildings and IT. This will also enable and help support how we work with partners, whether they're on the island or the mainland. I think it's through COVID, we've very much seen how we can work much closer together. Leslie mentioned about the collaboration, the pace we've been able to put in delivering some of our services through COVID. And I think we've built those relationships and we've got some fantastic learning from that. I think there are also great opportunities for our staff to learn and develop with working with our mainland partners. We're also experiencing seeing some of our smaller teams, members of staff actually rotating into those bigger units already. And the learning they bring back is absolutely second to none and will only benefit the patients that we care for. Finally, something again you'll see more of going forward is more patient and public involvement. It was very exciting to hear what Leslie had to say around co-production, doing things together and harnessing, you know, the technology, the virtual world, and enabling people to share their views of what the future can look like. So from my perspective, I'm looking forward to the next 5 years, and I very much welcome any comments or questions that anybody has.
Thank you very much, Nick. Well, that was a really upbeat presentation. Thank you for that. We have had one question from one of our attendees today, and they would like to know how success and performance of the partnerships and delivery of the strategy will be measured, which is a fantastic and massive question. But I'll bring you back in to try your best to answer it. Thank you.
Thank you, Kirk. Yeah, you're absolutely right. A massive question. I think what you will start to see, we will produce within our Trustful reports, you will see some of the quick wins, some of the evidence of actually where we've made a difference. There are already some examples we're seeing actually come to fruition, and you will see going forward, for example, where we've made service changes. Joe talked earlier about the fact that actually we want to keep as many services on island, and you will see some of our mainland teams actually working on island with us. Stroke is a really good example of that, so you will start to see us evidencing those sort of improvements. You'll also see through our recruitment that we will have not only more successful recruitment and joint posts or posts working across our partners, you will actually start to see the impact of that. So I would also say that Kirk will play a pretty key role in helping us make sure that we communicate out the benefits we see step by step through all the partnerships.
Thanks for that, Nikki. On your screens, everybody, is the next section, which is going to be on our finances. It's going to be led predominantly by Darren, a Director of Finance and Deputy Chief Executive. And then Vaughan will come in a little later in the section to discharge some of the formal bits of this meeting. So now I'm going to hand over to Darren to talk through his section. Thank you very much.
Good evening, everybody. For those of you who don't know me, Darren Cattell, Director of Finance and Deputy CEO here at the Trust. Apologies. I just wanted to say before I started to talk about the money and the finances, a big thank you to all our staff for their tremendous efforts to provide those great services to our whole island population and the patients and the users. That's the first thank you. The second thank you is to you, our wider community, for the support you've shown us as a trust and each other, particularly during this very, very difficult and challenging time. So more about the money and the finances themselves. I'm going to talk to you about three things this evening. The first relates to our financial strategy, which others have alluded to really, which is about how we improve our financial sustainability at the same time as our clinical sustainability. What does that mean? Well, it means how do we improve our operating financial performance on a day-to-day, week-to-week and a year-on-year basis, recognising that efficiencies are in our gift. We can deliver those efficiencies to some extent on our own, but particularly now through our trust strategy with our partners. So we can work to get some of those efficiencies that Nikki just described and Joe have described earlier on. There will be things that we won't be able to do though. And the reason for that is that we are an island service, we're an island trust, we're an island community. So all of that means that we aren't always able to provide things at the most optimum level in terms of efficiency and effectiveness. And the reason for that is we have to have a certain level of services here because of the risk of patients requiring treatment at any time of the day and night, and not necessarily being able to transport those patients over to the mainland quickly. So our financial future is more positive than it was. We've made some significant improvements and there are more to come. The really exciting bit that I want to talk to you about this evening is something that we've called investing in our future. And the investing in our future is our programme of work to ensure that we spend the £48 million that has been allocated to us by the government in the right way and delivering service improvement for our patients and the wider population on the island. That programme, we applied for that in the summer of 2018. We heard we were successful in the summer of August 19. And what I really want to talk to you about briefly now is what and when we're going to do what we're going to do with that money. Key things are on the screen now. So the emergency care floor, how do we bring together our emergency care services in one single footprint to ensure a greater flow within that facility? And within that, a high dependency unit, bringing our ITU and a high dependency unit services together on site at St Mary's. So we have a dedicated facility for those patients that require urgent and emergency treatment. The second thing that we're doing is investing in our community. Our strategy is very clear that our place, something that Nikki talked about, is very important to us. We need to invest in our community facilities and place care closer to patient and users' own homes and their communities wherever we can. So what we're doing is investing in first of 3 hubs initially to bring community mental health and primary care, and we're in direct dialogue and discussions with the local authority, the council, about how we bring adult social care into those services too. So we've got an integrated service hub in our community, serving our community. The next one, really exciting opportunity, and a number of people have already talked about digital opportunities that we have, and a number of things that we're already doing through digital platforms, using software such as this in patients' own homes. We've got a huge rollout program already with something that we're calling technology-enabled care in all of our care homes on the island to enable patient monitoring on a daily basis. But also the really important initial thing that we'll do is invest in our infrastructure. So the platforms that our software run from need a significant upgrade. And the most obvious one of that is around our network capability and Wi-Fi infrastructure. The next thing that we're doing is investing with our partners in how we improve care for our patients across those mainland partners. And for that, it's both ambulance station and services and IT infrastructure with SCAS, but also how we invest on the mainland in Portsmouth with our partner Portsmouth Hospitals University to care for our patients with the most complex needs. So we've got a wide range of investment. It's going to take some time to work that through. We deliberately designed this following feedback from our staff, our patients, our wider stakeholders and our community. But there's more to come in terms of what will work best for you as we progress through this. And so we're going to be inviting lots of comments and lots of interactions with people as we move forward. Thank you, Kirk.
Thanks, Darren. We do have a question that's come through on the Q&A before we move into the next section, which is about this year's finances. So if you don't mind, Darren, the question is, will the investment in estates and IT translate into service sustainability? Which is a fantastic question. I'm going to bring you back in now, Darren. Thank you.
It's a great question. Our strategy is all about clinical and financial sustainability. So it's a perfect question and linking topics together. We've been really fortunate to secure that investment fund to deliver some of those strategic objectives. So the investment in estate and IT will absolutely ensure that we work towards that sustainability going forward. It won't be the only thing that will ensure that sustainability, but it goes an awful long way. It's an awful lot of money and we need to invest it wisely. Shall I carry on, Kirk?
Thanks, Darren. Yes, if you don't mind, I'm just going to bring up the next section and I will hand over back to you shortly. Thank you.
Thanks, Kirk. So the third of three things to talk about to you this evening is our financial headlines. So our operating financial performance for the year ended March 20. So this is predominantly pre-COVID. We saw a deficit in year which was above our plan. So our plan was a deficit of £4 million after some incentive money, if you like, direct from the Department of Health. We did not achieve that. And the reason we didn't achieve it is the continued investment that the board agreed in our care and our services for patients. We felt that we were not able to deliver the level of and the type of care that we needed to and that you deserved within our financial allocation. So took some conscious decisions at board level to invest over and above our allocation of funding. We did specifically invest over £500,000 to reduce the length of time patients were waiting, and we invested over £7 million in our what we call our quality initiatives, so to improve the experience and the services that you, our patients and our users deserve. We did, however, have some successes. Whilst we can't count our financial performance against our original plan as a success in financial terms, but in quality and patient experience terms, I think we can. We delivered our cost improvement at our highest level that we've ever achieved as an organisation at £6.6 million. So those efficiencies that I was talking about, the things in our control, we achieved a significant financial saving in 1920. We invest in almost £10 million more in our people, our staff, during that financial year. So we considered a significant investment and approved that significant investment in our staff to ensure that we've got service sustainability as we move forward. And we invested almost £2 million more this year than we did last year in our capital investment programme. So those things that we needed to do in the shorter term, short to medium term, to invest in technology, buildings, kit and services for our patients. Thanks, Kirk. So this is where it gets slightly drier for most of the audience, I'm sure, around the audit results for 1920. It's the thing that partly gets me up in the morning, so I'm going to keep this fairly high level, but I've talked about the deficit. The really important thing in terms of our process to develop our year-end accounts and all of our management accounts going through the year, our external auditors, so external appointment and independent advisors, said there were no significant matters to report in the financial statements. So in old money, that was a true and fair view of our accounts. There was, however, a qualification, and that was because of COVID, the auditors were not able to travel to the island to count our stock at the end of the year. We also had a conclusion, which was an adverse conclusion, focusing on the value for money position, and that was because of the deficit that I've outlined earlier on. The auditors have to refer to the Secretary of State, and they have to build in a going concern statement in relation to our ongoing financial deficit. We aim to fix that ongoing financial deficit through our strategy and working with our partners to ensure that clinical and financial sustainability going forward. Thanks, Kirk. Next slide, please. So one sort of headline to finish with, in terms of our capital programme, this is how we spent our money. So you remember I talked about we invested £2 million more in our capital infrastructure than we did in the previous year. There are some examples here around the equipment, the estate maintenance, information technology, significant sum of money in our service developments, and a number of our audience to this evening will have experienced the emergency department, mammography equipment upgrade and replacement, as well as our outpatients department, which is now situated at the north of the hospital. Thank you, Kirk. So this is a slide really just to show that we achieved all of our process deadlines in terms of completion of accounts. Our auditors were able to complete their audit, and the board approved those accounts and were submitted and laid before Parliament, all in line with the timetable that was later this year because of the pandemic. That concludes my presentation, other than thank you very much for listening, and I'm going to hand over through Kirk back to Vaughan in terms of the adoption of the accounts from the AGM.
Thanks, Darren. You will be glad to hear that we didn't have any further questions on the finances. So without further ado, I'll bring our chairman in, Vaughan Thomas, to pick up the next section of the AGM.
Okay, thank you very much, Kirk. It's our responsibility to lay the accounts before you at the AGM. These accounts, as Darren has quite rightly outlined, have gone through an entire process inside the NHS and of auditing. They've also gone through a process internally in our board, and the board has approved them for submission into the NHS. So what I now need to do is formally ask you whether you are in support of adopting these accounts. For those of you who've not seen them and would like to see them, on the screen you can see in front of you a web link to where you can find them. They've been up there for some time. And the way we're going to do this is essentially a show of hands vote. And of course, we can't see your hands. So what I'm going to suggest is that if you, in the chat bar, just say yes if you are content to adopt the accounts, say no if you do not think they should be adopted, or say abstain if you're uncomfortable about commenting either way. And I'll give it a couple of minutes and Kirk will monitor, and when Kirk believes that we've got sufficient show of hands through the comments box, we'll be able to move on. Over to you, Kirk.
Thank you very much, Vaughan. I will just have a quick look in the Q&A section, and at the moment we don't have anybody saying no. Bear with me. We have a couple of yeses coming through, no abstentions, no no's. So we give it a few more moments just while, in case anybody's firing up a comment. And if not, I will, we have one more. We have another yes. Okay, I'll bring the chairman back in. We have no abstentions, no no's, and several yeses have just just popped into the chat. Thank you, Chairman.
Okay, thank you very much, Kirk. Well, I'd like to thank you all for your participation. I'm going to declare, on the basis of no abstentions and no negative votes, that the accounts are duly adopted, and we'll put them straight into the formal adopted area of the website. So good, thank you. I'm now going to move on to a segment which you'll see a slide in front of you saying reflections on 3 years as chair. I'm not sure you want to look at this slide for a long time because it doesn't have any content on it. The bottom line is that many of you will know is I've come to the end of my term of 3 years as chair, and I step down from the trust board at the end of next week. So I've already conducted the last board meeting, and I've already conducted my last integrated care partnership meeting, and this will be my last AGM. And what I'd like to say in reflecting on the last 3 years is, first of all, what an absolutely enormous privilege it's been to serve the trust and to serve the community of the Isle of Wight. I've just thoroughly enjoyed it, and I was, funnily enough, I was just looking at the photograph that they've got of me, which was taken 3 years ago, and I don't feel I look any older now, so it obviously hasn't been a difficult experience from that point of view. It's very easy to forget, though, that it was only 3.5 years ago that the trust received one of the most damning CQC reports possible. This is a complex trust, so although it's small, it has 27 different areas that the CQC inspects. And those areas are called domains, but they're things like our 111 service, our 999 service, our patient transport service, our ambulance service, our emergency department, and the like. And those are discrete segments of the business that are inspected. And they run across our ambulance service, our mental health service, our community nursing services, and the acute hospital. In 9 of those areas, so a full third, the trust was found to be inadequate for safety. And we were, of course, under those circumstances, issued with a number of statutory notices where we had to take immediate action, some of which, in fact, had as a potential ultimate consequence the likelihood that Maggie might be prosecuted as our chief executive. But we also had, quite apart from those absolutely immediate statutory notices we had to deal with, we had over 140 must-do actions. Now, must-do actions are things that the CQC and our regulators come back and check, and you're given a period of time, a 12-month period or a 6-month period, to just get those things done. 140 is an enormous number. Now, there were many, many contributing causes to us finding ourselves in this situation. But at its core was the fact that neither at island level, and that's across the health and well-being, health and care sectors on the island, nor at trust level did we have a clear strategy. And you've heard a bit from Nikki about that today, and you've seen the document that Maggie referred to, the Island Health and Wellbeing Plan. Those are responses to that matter. Now, in the circumstances we found ourselves, it's not at all hard to see that morale in the trust was on the floor, and that focusing on priorities was difficult simply because there were far too many. So by the time we got to last year at this meeting, thanks to our exceptionally talented workforce and their real commitment to delivering the best possible outcomes for those we serve, the CQC had rated us as requires improvement. So a significant improvement from inadequate, but still not where we wanted to be in good. And in the detail of that CQC rating, only one area was rated as inadequate for safety. So we'd gone from 9 to 1. And that area was an area, whilst we want everything not to be there, that area was one area that is consistently considered in hospital terms to be a very risky area and a difficult area to get right, and that's the emergency department. So over the last year, we've continued to drive those improvements forward. And you've heard some of that from Joe and Leslie and Darren, and that's continued and in some cases accelerated despite the impact of COVID-19. So at its core, we have not slowed down at all in the last year, despite it being a very difficult year. And we've also really got to grips with some of the causal issues. So Nikki's outlined the enormous progress that's been made both on the island and trust strategy, but in our strategy, partnerships were essential. And I'll come back to that in a minute. Now, what do we get from partnerships? We know from feedback from our partners, and that's the mainland partners we work with, that they get real improvements in their ideas about how to run services from the island. It's not as if we're an island with no capability. It's not as if we're an island without good practice. We have some exceptional practices across the trust, and they are being picked up by our partners, and they're being embedded in our partner organizations, and they are very grateful for that. So they see good practice and ideas coming towards them as a benefit from the partnership. In return, we as a community are getting scale, we're getting resilience, and we're getting some better practices from them, all of which comes to you in the end in better services and better quality of care. We know from our teams and our staff that what they get is professional camaraderie, they get advice, they get support from colleagues, and that all comes from the partnerships. So we know, for example, that sharing a training event or being able to phone a colleague that you've been on a training event with, or being able to hand a call in a call center across to a call center colleague on the mainland is very, very helpful to them, and they really value that. Now, some have suggested that these partnerships are a Trojan horse for some sort of takeover by the mainland. And in fact, we saw that in the question to Joe, and it's a fair question. Frankly, I disagree. Without these partnerships, the island's health system is simply not sustainable. In my view, lack of sustainability is a greater threat to good quality local services than the partnerships. So I don't see it. And as Joe said, there's been no conversation about any form of takeover or merger. There have only been conversations about doing things better for all parts of the population, be that our population or indeed the population on the mainland. Overall, the changes that are going on around us throughout the NHS, that's across Hampshire and the Isle of Wight and also across the country, are resulting in the creation of more flexible alliances and partnerships rather than to engage in what I would call the old paradigm of, we're organisation A and we own this individually. The future is in partnerships across the whole of the NHS. So it's likely that we will continue to see change, but not, in my view, a change that threatens on-island services. So where are we now? The board, through the executive, is constantly receiving feedback about the performance of the trust and how it's doing relative to our Getting to Good 2020 journey. All of the internal quality audits, all of the tests, and all of the checks that we do, and believe me, there are loads, suggest that we ought to be bitterly disappointed if the CQC now feels that it is unable to evidence a trust that is overall rateable as good. There is, of course, much more to do, but once the trust has been rated good, it ought to strive for outstanding, which of course should be our next goal. Finally, I would like to thank you all. I'm going to mention various people and bits here, but and I probably won't cover everybody. But I'd like to thank Patients Council, Health Watch, Unison, the Medicine for Members, Friends of St Mary's, all of our island partners, including the local authority, the CCG, the voluntary sector organisations, our volunteers, as well as countless individuals who have supported us on this journey from what was a very, very dark place. Personally, I've always been treated by everyone I've met with warmth, support and respect. I've really enjoyed my time at the Trust, and I look forward to seeing it continue to improve. Whilst I've chaired the Trust, all of the improvements are not my work. They're a result of the very dedicated and hard work of all of the Trust's 3,200 people. They work for you, the public, and on your behalf, I would like to say a very special thank you to all of them. Thank you very much.
Thank you, Vaughan. That was a really strong message of thanks there, and I'm sure staff across the trust will be grateful to hear those words. We've had a few comments to say thank you to you in the Q&A as well, which we can go through. We haven't had any additional questions at this point, so I'm going to now bring in Maggie Oldham, Chief Executive, to say a few words of thanks and to close out this year's AGM.
Apologies, schoolgirl error and was on mute. So thank you to Kirk and thank you to Vaughan, and I would like to share a few words before we conclude this year's AGM. Firstly, to all of our wonderful staff and volunteers who really are the beating heart of this trust and who do so much to support our community. To our partners on the island and across the Solent for their support on our Getting to Good journey, and to our community, the way they have rallied around us as we've dug deep to transform our services has been phenomenal, and throughout the pandemic their support has meant so much to me personally, but also to all of us here in the Trust. A huge thank you to you all. But before we close today, I thought I would like to say a few words about our Chair, Vaughan Thomas. It has been my great pleasure to work so closely alongside him these past 3 years, and I will be forever grateful to him for his honesty, support and leadership. It's difficult to sum up his contribution to our Trust and to the wider NHS on the Isle of Wight. Vaughan has at all times held our patients and service users at the centre of things. This focus has allowed the board and the Trust to tackle some significant challenges at pace and to improve things for local people and our staff. His clear vision for how this organisation should be run and how we should play our part in the wider NHS system has been crucial in our improvement journey. I have enjoyed working immensely with Vaughan, and I will miss him very much. So on behalf of everyone at the Trust and our wider community, I'd like to say a huge thank you and good luck with your future endeavours. Thank you.
Thank you very much, Maggie. And all that remains is to say a massive thank you to everybody that's dialed in to this year's AGM. The first time we've had to do it in this format. If you didn't manage to catch the whole of tonight's proceedings, this has been recorded and we'll be making it available on our website. But from me, Kirk Millis-Ward, the Director of Communications and Engagement, and the rest of the panel for today's AGM, a massive thank you and good night.